Come in.
Hello, my name is Lakeisha, and I will be your student nurse for today. Is that okay?
Yes.
All right, I have a few questions just to get the visit started. Can you tell me your full name,
Kyla Ollie.
date of birth,
09/27/2000.
what year is it,
2023.
and who is the current president?
Joe Biden.
All right, very good. Can you tell me what brought you into the clinic on today?
I'm having chest congestion, cough, and my heart is racing.
Okay, so you're having some heart palpitation. Let me ask you this. Do we have any medical history?
Yes.
What problems have you been told that you have?
High blood pressure.
Okay, you have high blood pressure, so are you taking any prescribed medications?
Yes.
Okay, I did see on your record that you were prescribed lisinopril, which is a high blood pressure pill, is an ACE inhibitor. Do you take it every day?
Yes.
Okay, very good. What did you use or what are you taking over the counter for your cough?
It was cough syrup.
Okay, did it contain a decongestant?
Yes.
Okay, how long have you been having a cold?
For 2 weeks.
Okay, all right. Well, the first thing that we want to do initially is to go ahead and do a cardiovascular exam and a respiratory exam. Would that be okay with you?
Yes.
Okay. The first thing that I want to do initially is just do an inspection of you. So if you don't mind, just look straight ahead at me. What I'm simply doing is just observing you from head to your chest area, just to see if there's any abnormalities to make sure that we have even skin tone, which you do. I don't see any rashes or lesions or any bruises. During the exam, some things that you should know, you will feel my hand to touch you. You will also see me do a percuss over different parts of your body. You will also feel my stethoscope. I will use this to listen to the different lung sounds as well as your heart sounds. Will that be okay?
Yes.
And anytime if you feel uncomfortable, please just let me know, okay?
Yes.
So initially back to the interior portion, I do not see any visible abnormalities. What I like to do first simply is to start posterior first, which is your back. So if you don't mind, if you could turn this way for me. And what I do is simply just move your hair. Right now she is wearing a tank top for recording purposes, but on a normal exam, of course, she would not have any clothing on. She would have hospital gown. So what I want to do now is simply, as we did on the anterior portion, is just simply to inspect. What I do see is that her spine is midline. What I do see is that her muscles on both sides are symmetrical. I don't see any visible masses or lesions from inspection. What I'll do now is simply what we call a palpitation. What I'm going to do is place my hands on your posterior back and just lightly palpate across your posterior of your back. Any tenderness or pain?
No.
Okay. The next thing that I would do is to percuss over your posterior back. This provides different resonance sounds that I would need to know. So we will start here and just percuss from your right to left across your posterior back. Just listening to the different percuss sounds. Also, to make sure that we have even lung expansion, what I want to do is just put my hand in your lower back and ask you to take a deep breath. Let it out. One more time. Very good. What that shows me is that we do have even lung expansion. The next step would be to simply auscultate your different lung sounds. What we would start with first would be initially the apex of the lungs. When you feel my stethoscope, take a deep breath and let it out for me. You ready? Take a deep breath. Let it out. Take a deep breath. Let it out. Take a deep breath. Let it out. And we would do the lung, assessing the lung sounds throughout the entire posterior back. Can you put your both of your hands on your hip? And this is just to hear the lower lobes. Your right lung have 3 lobes and your left lung have 2. One thing that I did want to do with the percuss, just to test to see any pain or tenderness.
No.
Okay. At this point, need for you to just turn around to, you can just lay on your back at this point. The same thing that we did posterior, we will also do anterior. The first thing that I would want to do simply is to palpate the anterior portion of the chest, just to see if any palpable masses or tenderness or pain. Any pain or tenderness?
No.
Okay. The next step would be simply, I can go ahead and do the percussion. All right. The next thing that I would do would listen to the different lung sounds, starting at the apex of the lung, which is slightly above the clavicle bone. Take a deep breath for me normally. Excuse me. And we would do this down the entire anterior right and left lower lobe, simply listening to the different lung sounds. Because we are in this position, I can also go ahead and assess her different heart valves. With my stethoscope, of course, I would use the bell to listen to those heart valve sounds. Here we have a aorta, and the reason for listening to the heart valve sound is to rule out any murmurs. Here we have the pulmonatic valve. Here, the midpoint, we have the Erb's valve, the tricuspid. In between the fourth and fifth intercostal, we have the mitral valve. This is the apex of the heart. I can also listen to your apical pulse. I will actually listen to your apical pulse here for 1 full minute. Because she's in this position, I can go ahead and assess her brachial pulses and her radial pulses. Can you sit up for me on the side of the bed? One thing initially that I did that could have been assessed initially when assessing her anterior portion, I could have assessed her carotid arteries, which you are to palpate one at a time. And at this time, when you take a deep breath and let it out. Take another deep breath and let it out. Here, with all of her pulses, they are 2+, even on both sides, as well as in her radial. Because she's sitting on the side of the bed at this time, and I also can check her popliteal pulses. Also, I can check her dorsal pulses. Are there any questions?
No.
Any other problems?
No.
All right, we have a 57-year-old that came into the clinic with congestion and cough for 2 weeks. History of hypertension, was prescribed lisinopril, was taking a decongestant cough syrup over the counter. At this point, the member is very alert and oriented time 4. No skin abnormalities, skin tone is even for her race. No lesions, no rashes. Her lung sounds were clear bilaterally. Her heart valves were noted. No murmurs were detected. In my assessment, there weren't any axillary muscles being used, so there were no signs of distress. At this point, we would pretty much reevaluate and educate on medications that can be taken over the counter due to hypertension. Because her blood pressure pill was an ACE inhibitor, one of the side effects is a dry cough. With your cough, were you coughing up anything?
No.
So we would reevaluate her blood pressure pills just to see if that's a side effect of the lisinopril, as well as educate on her not to take over-counter medications such as cough syrup with a decongestion. Because she had the increase in heart rate, the palpitations, we may also do an EKG just to rule out some things. So at this point, we have done a cardiovascular respiratory exam. Thank you. Any questions for me?
No, ma'am.
Thank you.